All right, so we're going to spend a little bit of time now. In fact, we're going to spend more time than we've ever spent in an annual meeting on our strategic initiatives. Yesterday, we had our strategic initiative meetings, and they were really well attended. I do want to remind people what Bill said this morning. We have more than 200 people who are participating in those 6 initiative committee work groups, and I would very much like to have us, those of you who are not participating, to think about how you yourselves or someone in your organization might participate in these conversations. I think the value we bring is the diversity of membership that we have, and we have an outstanding membership, but at the same time, if you're not engaged in the conversations we're having, your perspectives aren't being included, and we want that to happen. So we've been featuring our initiatives. We did yesterday. We're going to continue to do that for a little while today. We have very dedicated chairs who've been working with us. They're going to spend a little bit of time today for the whole membership, talking about each initiative, obviously much more briefly than we did yesterday, about where we're going, what we're thinking, what our next steps are going to be, et cetera. But I do want to point out to you that there are some criteria that we use as an organization to decide what we work on. And I want to show you, first of all, these first 6 criteria for strategic investments that we make. And these are the criteria that are used by our mission committee to determine when and what things should actually be a part of our program of work each year as they prepare their recommendations to the board about what to budget for. So the first criteria is we want to obviously work on things that hold significant impact relative to incidence, mortality, morbidity, survival, and or quality of life. We only are going to work on things where we depend upon access to the 3 sectors for development and dissemination. We want to deal with things where we have some consensus within you all as a membership that there is a need or a gap or an opportunity to accelerate, and that means we're not duplicating. That's the reverse of that. We also want to work on things where it's unlikely that those issues are going to be addressed or resolved in a timely manner without our leadership. We want to hold broad resonance and appeal across the membership. And one reason today that we're sharing our initiatives with each and every one of you, all 6 of them, is because many of you are not able to participate in some of those discussions yesterday. But at the end of the day, the only way we're going to be successful is if the whole organization stands behind each of the 6. So we want everybody to know what each one is doing so that when the time comes and we issue a call for action, even if you haven't been a part of the discussion, you have some idea of what we're asking you to do. And then finally, we want to have and represent leadership consensus that the project, strategy, and tactics are likely to achieve some real results. And then there is a second list of criteria. I don't know why I keep pointing at that. This thing probably has nothing to do with that screen. The second list of criteria includes, prior to launch, that we've aligned member commitments, including leadership, expertise, and in-kind funding, resources, either in-kind or funding. We have a well-defined scope and measurable outcomes that we can say we actually did something, we achieved what we intended to do, or hopefully not, but if we didn't, then we know that we didn't and we can move to a different strategy. We also want to have a defined exit strategy. Our responsibilities are not necessarily, quite frankly, to carry things on forever, but in some cases to catalyze, and where that's the case, we want to catalyze and then move away. But we have to do that in some systematic way. And then finally, we want to have things that represent clear calls to action for you all as we go through this effort. That is, that each of our members has something to contribute to the delivery of what we're doing. Now, the first half of that criteria speaks to our filling a unique space. That was the previous slide. This is more about leadership and our own internal planning. But at the end of the day, this is the most important filter, and it's the summation criteria for these items. And that is essentially that as an organization, we have made some commitment across the 3 sectors that takes advantage of our unique membership. The one unique item, Gary Reedy's fond of saying, the one unique thing about Sea Change is we have leaders from all three sectors sitting at the table. At the end of the day, if our strategies and the things we choose to work on don't have all three sectors engaged and we're not taking advantage of that leadership, we don't go anywhere. And while we've said three-sector leadership in the previous slide, there's a whole different thing when you say the filter is, have we taken full advantage of our three-sector opportunity here in order to make something happen? So I want to emphasize that. Now, with our strategic initiatives, we had 2 years ago in Kennebunkport, we made a decision. It was 2 years ago, I must say. It seems like about 40 years at this point, but about 2 years ago to make a fundamental shift in what we were going to address. And we decided that we were going to take on foundational systemic issues that we are facing. Even though they may take a long time to solve, we are going to make those longer term commitments. This is not about one-year projects. It's not about projects that are of interest to a handful of our members, but foundational things that we can all have an impact on. And we made that shift, and as a result of that, moved in the direction ultimately last year of selecting 6 strategic initiatives. And I think you all know what those are. They were part of the agenda yesterday, obviously. So now that where we are, our issues now are focusing our leadership and attention and resources on these big picture systemic issues. These are long haul topics. It's important for us as an organization to understand we're not committing 1 year at a time to these. We're committing to addressing these over the long haul. I do think in the discussions that I was in yesterday, a lot of rich discussion, a lot of really interesting and good ideas came out. Far more ideas than we'll ever be able to act on. And I think what you're going to see us doing with you by various means over the next two months as we move towards 2012 is actually putting a pinpoint on those and saying, here are the things that we will actually do that fit our criteria, because we can't do all of the things that were suggested yesterday. It's very important for us to reach that pinpoint. I don't mean this pejoratively about where we've been as an organization. I feel very good about where we've been and where we've come from, about what we've accomplished in the past. But we now are at the place where we have to move beyond the philosophy and beyond the opportunities, the multiple opportunities, and actually take some very specific actions starting in 2012. And that's our challenge. And so along that vein, what we've been doing throughout 2012 is consulting with our different members, et cetera, at various times and in various ways to try and build even stronger advisory committees. And I am really pleased to say we have more member engagement today than we've ever had in our history as an organization. People are actively sitting at the tables and participating in the conversation. We want to build more and stronger ties with key organizations and committees. I want to mention just one example of that that I brought up before in a couple of places. But we now have people sitting on our committees who are not from the cancer community, who are in fact focused on other disease entities. We have applied for membership in the National Forum for Heart Disease and Stroke. They have been accepted for membership in our organization and are sitting at our tables. We were fortunate to have the opportunity to participate last week in their annual meeting where they were talking about their strategic initiatives. And we're delighted to have that kind of a relationship, because as we know, the problems we're trying to face in our initiatives are systemic problems that extend beyond cancer for the most part, and that what we bring to it is that cancer lens, but the ultimate solution is going to involve other communities. We've also seen this in the HIPAA project, where we have groups like the Infectious Disease Society and others who are sitting at our table as well. We've also spent time this year studying the HHS strategies that have resulted from the Affordable Care Act and other national efforts that reflect our work, and are looking for those connections about where we can bring some value add to those conversations, which again are happening outside of our own community. We spent a lot of time actually this year commenting publicly on strategies and regulatory changes that are part of ACA. These include areas related to HIPAA, high tech, and things like that. We've begun refining our lines of work for each initiative, and we still need to do that next step of getting down to the hardcore of what the actual piece that Sea Change will do. And as I said, we'll be working on that over the next few months. And then we've completed a number of efforts related to building consensus, defining guiding principles, doing some of the foundational studies that actually lead to the work that we're doing. So we're going to continue to focus on these 6 initiatives going forward. We have some really good input about our overall direction from our mission committee that we'll be sharing with you after they share it with the board of directors. And I think it's an exciting time, an exciting opportunity for us. We do need more focus. That is, we need to get each of these pinned down, and we will be working with you to do that, as I said. But it is decision time. It's decision time to narrow that focus, to start defining that clear role that Sea Change will play, the clear expectations and the metrics that will tell us if we have success. And I think it is very important for us to be bold about what we're doing. So before I introduce the first panel discussion, I do want to say a couple of words in response to a couple of things that were said this morning in our panel. The first one is that I was really intrigued when Dr. Rivlin talked about all of the blaming that's going on both sides of the aisle, and the word she used was all of those things are irrelevant, and that there are other things driving our system. I think many of those are known to us, but I find it hard sometimes for me personally to, if I'm listening to the daily news or something, to see these things as irrelevant, because it's nasty and it's loud and it's vociferous. But at the same time, I was impressed with that. But she also said something else that was very important, and that was that we've known about those systemic problems, that is our aging population, which I'm not a member. And apropos of the value discussion, I'm also not going to die. But I think the important thing she said is that we've known for a long time this was coming. This was not news, and we ignored it as a nation, and her words were, we sat in rooms like this and then we didn't do anything. I think our challenge is to say, we're not going to sit in the room anymore and not do anything. We've identified some of these things that could be done, that should be done, where we have a common interest in this room, and now it's time to do them. I don't want to be somebody 10 years from now giving the speech and saying, Sea Change sat in the room and didn't do anything. At the end of the day, they just kept talking. So this is our challenge as we go forward. We can't ignore the economic backdrop. It's real. That means we too within the organization have to find compromises for the things that we think. At the same time, we have a unique opportunity to take our initiatives and build them in as things that actually help on the economic side of the equation. Because in virtually every case, the things we're talking about, if we actually implemented them, would in fact contribute to solving some of the economic problem. So what we're going to do for the next couple of hours, and not a couple of hours before lunch, but an hour before lunch and then some time after lunch, is talk a little bit more about our strategic initiative. So you're going to hear from the leadership about each of those initiatives. We've designed a panel format for this meeting that allows not only the chair to speak, but also some of the members of the panel who've been part of the thinking and who have their own unique perspectives. As you listen to them, I would really like, again, as I say, for you to think about how you as an individual or others in your organization might tag into the work that we're doing, and seeing how we can create some synergy that will help you both with your work and your mission, as well as advancing our collective mission. The first discussion we're going to have is around value in cancer care, and we have a great group here working with us. The group is chaired by Dr. Alan Lichter, CEO of the American Society for Clinical Oncology, and he's joined today by Nancy Davenport-Innes with the National Patient Advocate Foundation, Arshawn Morrison from the National Palliative Care Research Center at Mount Sinai, and by Linda House from St. Vincent Indianapolis Hospital.